Hello, today I have a new patient. Her name is Lilia, and she kindly agreed to participate in our video today. So tell us now about your problems and what we're going to start working on with you today.
Hello, my dear friends. I turned to Vyacheslav for one simple reason. I have a sedentary job and my back hurts a lot, especially the coccyx. If I work more than 6 hours a day, I start feeling not quite well in terms of the condition of my back. And sometimes even my neck hurts a lot too. I turned to Vyacheslav and I had one session with him. Today is our second session. After the first meeting, I noticed a clear improvement in my condition and well-being because the pain in my back had reached a point where I couldn't sleep at all at night. And after the first session, I fell asleep peacefully and felt so good, so I came for the second meeting.
Very good. So, Lilia is a psychologist, and she's going to say a few words. And I would also like to talk to patients about the relationship between the psycho-emotional and the physiological states and the way they interrelate.
Yes, my friends, I'm a psychologist. I mainly work with panic attacks and some neurotic disorders. It has always been interesting to me because I once dealt with this phenomenon on my own. I want to briefly tell you about the reasons for the formation of tension in the body. Firstly, it's a person's lifestyle, and as in my case, sedentary work. It means that the body is constantly stuck in one position. The second principle is chronic stress. Well-known psychosomatics. How it happens, the nervous system sends an impulse to the body, muscles contract, and tension is formed. Therefore, stress affects our physical body. Everything is interconnected.
Yeah, these spasms eventually cause, let's say, like displacements, meaning muscles attached to bones, and the bones start stretching in one or another plane. So our task here is to relieve all of these spasms and correct the joints and the vertebrae into anatomically correct positions. Okay, so now we're going to begin the diagnosis, and then the massage and the manual therapy following. All right, so let's look here. Here in the lumbar sacral region, we have 2 points. The legs are straight, so let's take a look. A little bit to the left, the pelvic goes due to the spasm that's going on the left side over here. The more muscle tone also that's here on the right. And turn slightly to the left. So there's some tension here in the area of the L5 to the S1. And then on the left side, there's more tension in the lumbar region. And then also, let's check out the scapulas and shoulders. So the left shoulder is slightly lower, and the right one is slightly higher, and it's turned like this. If it's visible to the camera, the torso is slightly turned. So now, your neck. Was it still bothering you? How's your neck feeling right now?
Yes, it was.
Okay, so the neck is also suffering often because of this upper thoracic area. So here, there's more muscle tone on the right side, and here's the angle. And the right shoulder is pulled a little bit more up, and this side here is slightly lowered. So because of this, we now need to go ahead and align it. We're going to relieve the tension in the thoracic lumbar region, work with the shoulders, and then the thoracic region and the whole body as well. So go ahead and align your stomach. So now we're going to adjust the sacroiliac joint. So right here on our left side, everything is more pulled to the left. So we're going to grab the ilium here, relax just like this, right here. We have the lower ribs. Relax a bit more. Okay. Very good. So now we're going to do the lumbar spine. It can be a little bit difficult to grab here sometimes. Sometimes your skin and sometimes not. So right now we're going to do a crisscross, and I'm going to show you guys without the towel. So here on the crest of the sacrum, the palm, and on the lower ribs. And this is how it stretches. It stretches just like this. Alrighty, so One more time. Very good. Excellent. Now we're going to check from the right side, the lumbar region. Here, the sacroiliac and lower ribs are adjusted when we do this process. So now we're going to straighten the thoracolumbar transition. We've already done the massage, so it's not included in the video. If anyone is interested, they can also watch that in a separate video that we have on our channel. Just check our channel. So now we're going to be filming the adjustments. So take a deep breath, exhale. Relax. So how does it feel now?
Wonderful.
Here, the shoulder, the clavicle, taking the head of the shoulder joint right here, and here, like this. 1, 2 ribs between the shoulder blade and between the spine. Like that. All done with the muscles. No direct pressure on the bone. So it's just going to slightly relax the amplitude and stretch, just like this. Okay, so let's check her neck right here.
It's reacting.
Yeah. Now let's check from the left side, and there's some more spasms on the right side of the neck right here.
Oh, good.
Head at a 45-degree angle and your shoulder back. Then we stretch it here.
Oh, that's good.
Stretch. One more option, adjusting the sacroiliac joint. Just like this. I'm going to show you guys.
Is this gymnastics?
So relax.
Oh.
So place your hand on the sacrum here and stretch. Just like that. So now you're going to move your pelvis closer to the edge.
Like this?
Like this. And your hand here.
I'm ready.
Lower leg straight. Like this. And on the other side. No, first move the pelvis.
Okay.
Okay. Lower leg straight.
The lower one.
Yeah. Put it here. Relax, relax. Okay. So get up. Here we can see in the upper thoracic that there's a bit of vascular changes. And still, the right shoulder is moving forward a little bit. So now what we want to do is stretch the upper thoracic with these movements. So let me show you guys. Place your hands behind your head. And like this. Feet stay in place, don't move anywhere. Very good. Stretch. Like this. Don't think, relax. Very good. Now the hip joint. And the second hip joint. So put your leg like this. We want to remove the restriction of mobility here. That one's tight, but this one's good. All right, relax. No control. A little bit more.
It feels like an injection.
Huh?
It's like an injection.
Relax your muscles. Come on, you're not relaxing. More. No, don't think. It's swinging freely, but we need a little more. There we go.
Oh.
Come on. Okay. So jaw close. Yep, relax. No, you're not relaxing. Relax.
Oh my god.
So how does it feel?
It hit my head, just like last time.
Like you hit your head? Where?
In the temples.
In the temples?
Uh-huh.
Now the paravertebral arteries have cleared, so that's why you're feeling it in your temples.
And I feel that the shoulders, the back, as if they've been released.
Well, because where did it stretch when I pulled your head?
Oh.
Where did it stretch? Did it stretch like in your lower back? Is that where you felt it?
Not to the lower back, but onto the shoulders. The temples, this area is good, but now the lower back is starting to feel a bit chewed. But the temples feel really good.
Now I'm just checking for mobility. All right. Now relax. Very good. We did a stretch after decompression. All right, good. Now put your chin to your chest. Shoulders relax and take a deep breath and hold it. Relax. Keep your head straight. So now our shoulders have become more even. And regarding the lower back, here, the thoracolumbar transition, we want to work on that for a few more sessions for sure. But for the shoulders, it did get much better up at the top. So why don't you tell us, how do you feel now, Lilia?
I feel much better in the sense that my body has freed up, and there's such a sense of freedom. And the blood, it circulates everywhere. It feels amazing.
And do you have any discomfort right now?
Absolutely none. I'm feeling really good and free.
Okay, well, thank you.
Thank you, too.
All the best. And until next time, I just wanted to say a few words and answer some key questions. First of all, you guys ask, why do I only film women? So first of all, it's not only women. I also have men on our channel. And about women,